Hey, also for this week's research spotlight, I thought I would do a very recent article on COVID-19. So it's physiotherapy management for COVID-19 in the acute care hospital setting, clinical practice recommendations. And so this was an article that the hospital that I'm currently at now used to help develop some of the COVID-19 related guidelines that we're following. And basically this was like an emergency meeting of the minds, and they got a bunch of therapists together, the authors here, and they all kind of put recommendations in, and then they kind of decided as a panel, and as long as more than 70% or 70% or more of the panel kind of agreed that the recommendation would be a good recommendation, they put it through into the article so they could fast track the publishing process and get the whole thing kind of put together and develop some high quality recommendations from therapists that are working in the setting, that are involved in the ICU, have a cardiorespiratory background, could kind of use their expertise to put some things out there for all of these therapists that maybe aren't as familiar with these types of patients. So from that standpoint, I feel comfortable using the recommendations that they have, that they had a whole panel of people kind of discussing it and looking at it, and that they used a general consensus, and they didn't just kind of throw a bunch of random things in there. So basically, it kind of goes over the pathophysiology of COVID-19. SARS-CoV-2, I think, is the virus type or whatever. And then kind of just a little bit of the impact that it has. So it spreads much faster than they anticipated it to, and it has a much more, can have much more lasting implications than the traditional flu, with about, I think the article cites like 80% of people having mild to moderate symptoms, but then those who don't have mild to moderate symptoms are very severely impacted by the virus and are really low level because of the infection. So it kind of goes into some recommendations for who you would select for therapy based on symptom presentation and things like that. It seemed relatively similar to a lot of other types of screening protocols for the acute care setting, so I'm not really going to go over that too much. And then it kind of goes over resource allocation management, just to help people who, or hospitals who are having these massive influxes of COVID patients, how to best allocate resources and try and do things there. And for the PT recommendations in terms of intervention, talks about how PTs can use airway clearance, breathing, secretion clearance techniques, mobilization, early out of bed, mobilization, position changes, positioning to help relieve pressure if they're going to be in bed for a long time, and just checking my notes here. Yeah, and early mobilization was one of the biggest things that I think that we can help with, that I kind of took away from it. So other than the respiratory therapy that we can provide, kind of digging back to our pulmonary rehab courses, also just the mobilization of bed mobility, getting up to sitting edge of bed, getting out of bed into the chair, and progressing with positional tolerances, and then just generalized mobility, and trying to get a head start on or even prevent ICU acquired weakness. That's a big thing that you want to try to prevent, especially with these patients who are ending up in the ICU for so long, and then working with them after their ICU stay to build some strength back up and become functional again. And so there's some of the big takeaways that I got from this article. I will put the links and stuff like that below. It does have like tons of different charts with recommendations and things like that. I don't remember all of them, but it's kind of a really good, quick synopsis, comprehensive document to look at if you're going to be working with COVID patients, or you want to have a quick background and synopsis of what you might be having to work with or deal with. And obviously PPE is important, and kind of just being conscious of equipment and resource allocation. You don't want to be bringing equipment in and out unless it's absolutely necessary, and that kind of stuff. So that's this week's article. Physiotherapy management for COVID-19. It's, obviously there's a lot of news around this virus, and it's a very serious and a very real thing, and patients that do have the virus are very sick and need our help. So I think this is a good article to kind of cover this week, and hopefully you'll find it interesting. Thanks for watching.